Hello, everybody. Welcome to today's session. We have with us Lea and Concetta. They're both pelvic floor physiotherapists. I'm more than happy to give back to the community by sharing what they know about dilator therapy, pelvic wands, how to use them, and we will have a Q&A session. So if you have something you'd like to ask, feel free to drop it in the chat, either openly to the public or directly to myself. Other than that, I will give you guys both the floor to introduce yourselves. If you want me to change the screen, I can just click the button and do so there.
Perfect. Great. Thank you, Asia. Thank you for having us. We're very excited to be here. I'm Concetta. I am a physio at Raise the Bar Physiotherapy with a special interest in pelvic health. And I'll pass it over to Lea.
Hi, everyone. My name is Lea Damata. I'm a physiotherapist, also with a special interest and years of experience in working in pelvic health physiotherapy. And we say pelvic health because it's not just your pelvic floor. So it really is a holistic approach in how we treat and work with anyone who has a pelvic floor. So today will just be one of the many things that we talk about and work with our clients. And know that there is no silly, weird TMI question. Like, that is what we're here for. And like, you would be surprised the questions we get asked on a regular. So if it's easier for anonymously to send that, you definitely can. And we're happy because I will tell you, you're probably not the only person asking those questions. There's likely someone else either listening to this live or afterwards with a similar question. So I just want to kind of state that before we get started, and that this is a safe place to have any and all of those conversations. And I'll pass it back to Concetta to start our presentation.
Yeah. Thank you, Lea. That was perfectly explained. So if at any point, feel free to ask anything. We're going to start with giving more of an overview about dilator therapy, and then we'll make that comparison to pelvic wands. So when we look at dilator therapy, so this involves usually a conical or cylindrical device that's inserted either vaginally or anally. And the purpose is to help increase tissue flexibility and elasticity in that area through stretching. If you take a look at Lea over here, she's showing some of the dilators similar to the ones that are pictured above. With dilator therapy, this can also be very beneficial when it comes to desensitizing tissues, which can help people reduce any fear, anxiety, or pain that might be linked to vaginal touch or intercourse. And that's a really big component of it, is helping to bring our system down from any fight or flight response that may be happening due to potentially past experiences or negative experiences. So that's the other side of the therapy that's very helpful. Applications often used for vaginismus being one of the big conditions, or general sexual pain or discomfort. And previous studies have shown that through electromyography, so looking at the actual muscle response, with dilator therapy, this can help to train pelvic floor muscle relaxation, especially during penetration. So it helps with that tissue, that elasticity, and just bringing everything down to allow for more of a smooth process. It can also help with skin tolerance. So just helping the skin around the pelvic floor improve its ability to handle the sliding motions of the dilator to eventually prepare that area for penetrative intercourse. Next slide, please. Beautiful. So pelvic wands are slightly different in the sense that they're therapeutic tools that can be used internally for self-treatment of the pelvic floor muscle tension. Leah's holding one of the wands here, which again is quite similar to the photo. So this can really help to release any trigger points and perform soft tissue massages within the pelvic floor. It's often used for different conditions such as chronic pelvic pain syndrome, bladder pain syndrome, generalized pain with intercourse, which is known as dyspareunia. And studies have shown that pelvic wands, if combined with pelvic floor physiotherapy, where you're seeing a professional and getting individualized, tailored approaches, it can help to reduce overall pain, tension, and just generally improve quality of life. And it's commonly employed for long-term management of pelvic pain through self-care. Now, generally, what we notice with pelvic wands is, especially in cases where an individual may have vaginismus, where there's that initial difficulty with penetration due to muscle spasm, This is something that can be introduced through later stages of the treatment plan, given that it targets those deeper areas of pelvic floor and helps with applying firmer pressure to help release those tissues. This can also be beneficial earlier on in the treatment plan for patients that have pain with deeper penetration and deeper intercourse and are generally okay with that initial entrance and initial penetrative sex. So there's different uses. It could be used later, it could be used earlier, but still shown to be beneficial of releasing those deeper, harder to reach areas, and can be combined with the dilator therapy for sure. Next slide, please. So there are some generalized guidelines to using dilators. So generally we want to establish a consistent practice routine, generally 5 to 15 minutes per day based on one's personal commitment. It's important to mentally prepare and relax before starting, using ample water-based lubrication for comfort, especially with those silicone dilators. We want to avoid any silicone lubrication and not mix both of them together. We also want to focus on cues to help enhance the muscle of the pelvic floor. So with inhaling, we want to imagine that the muscles are lengthening, opening up, almost like a flower blooming. And as we exhale, we want to imagine that the tissues are slightly lifting and contracting to help to facilitate that exhalation process. And then when ready, after using it multiple times, we can also introduce any sort of sexual arousal, either on yourself or introducing a partner, and consider generalized guidance or advice if you're also involving a sex therapist in your care. Ideally, removing the dilator after 10 to 15 minutes, cleaning it with mild soap and warm water, allowing it to air dry, pat dry is also important to prevent any infection and just ensure we're maintaining proper hygienic routines. So these are very generalized guidelines. It's important to be aware that everyone is going to have their unique circumstances and unique situation. So oftentimes getting that individualized advice will be best to see even different positions that using that dilator will feel the most comfortable and best for you, and especially during those early stages, which Lea will touch on in our next slide.
Okay, so before I go into specific kind of techniques and insertion criteria, I always start when talking about this to anyone that it's more about what you're doing than the progression. I often have clients that are like, I can't wait to progress to like, as I showed you, like this is the smallest size and this is the biggest size. So clients feel like they're not progressing if they're not moving up in size. Size is only one of the pieces of the puzzle. And there's so much to do with each size that you have. And so it's really about taking it slow and working at your own pace. And as Concetta mentioned, it's really individualized. So what might work for one person is going to be completely different for another. And that's why having that specific kind of individualized care can be extremely important to see what is working. And one day this might work well, and then another day, things are better and you can progress more, or you're having a stressful day and things are not going as well. That is also very normal and a part of that healing journey. When it comes to using dilators, there are so many different techniques you can use. So we always recommend starting with the smallest size, and when you're feeling comfortable, then gradually progressing in size. And really the big piece when we think about kind of the pelvic floor component and why are we using this, often what's happening is that our body is hugging and loving ourselves a little too tight. And that comes from a really good place of overprotection. And so that can be linked to a lot of this sensitization of the tissues where it's in this protection, like this is dangerous, this is a threat. And as a result, there's a pain output. And so by using these different tools, it allows us to have these exposures in a safe and calming environment where you're actually able to relax the pelvic floor through the breath work, but then also have these newer experiences where it's like, oh, this actually isn't a threat. This isn't dangerous. This doesn't feel so bad. And then there's no longer that pain output. So then we're creating these new cycles of a positive experience. And that is actually the foundation of why we use it. Now, different techniques use it. So I'm going to kind of use my finger as if it was the vaginal opening. And the way that I describe it is the top is 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock. So kind of like a clock. This might be backwards as you're watching it. So I apologize if that's the case. I'm going to show it on the smallest one just because it's the easiest and it'll fit my small hands here. But again, you would use based on kind of where you are in your recovery. So in your journey, I should say. So when it comes to starting off, you actually want to progress first is even just the insertion. So you may only just be putting it at the entrance. You might not be, the goal is to go all the way in, and just getting used to that. And then maybe you're holding that for a minute or a few seconds, and then you're taking it out and then coming back. As you're doing any of these techniques, using the breath work, as Concetta mentioned, is super important. And she talked about kind of thinking of a flower blossom. So if you visualize a flower where your vagina is, and as you inhale, think of those flower petals blossoming in every direction. That's your pelvic floor, and that's what's happening. And you want to focus on the inhalation to let go, and then exhale, it just naturally recoils back to center. And the idea is if you're doing that breath work, it actually allows for more accommodation as you're going in. So instead of it being kind of stuck really tight, it's now actually a wider area. So it allows for further. And again, that comes back down to feeling safe and feeling comfortable and giving your body that permission to let go. And so, as I said, you're going to start like very small at first, just kind of getting comfortable with it. Once you're starting to insert, another thing that you can do is actually practice going in different positions. So maybe you're at 6 o'clock and you're going to press down a little at 6, then you're going to press at 7, or you're going to go towards 3, and you're just getting comfortable kind of in different positions. Over the years, I found clinically the bottom half tends to be the more sensitive area. Again, oftentimes for women who've given childbirth, for example, who've had episiotomies or tearing, that's often a commonplace. But there can be so many reasons as to why we experience pain with intercourse. And so really kind of just working on any of those areas where you're feeling that pain, that sensitivity. And I always kind of, when we're thinking about pain tolerance and how much should I push and what's okay and what's not okay, we kind of grade it from 0 to 10. 0 being no pain, 10 being 10 out of 10. You never want to be more than a 2 or 3. Less is more. I cannot emphasize this enough. If we try to push past pain, we're actually not going to make progress, because what's happening, our body's going to be like, this is bad, this is dangerous. And what do? You go back into that overprotection. So working within a really small range of what's okay, and just slight discomfort or slight burning or sensitivity is really where we want to be. And you'll notice as you're doing your breath work and you're getting used to these different sensations, the better it'll start to feel. And then that's an indication that you can start to progress. So we talked about kind of the depth going in. We talked about kind of pushing down. You could also kind of do sometimes some circular motions as a progression. And then the idea is to really go into function. So what's the function of this is to return to pain-free intercourse, whether that's with a partner, whether that's with a toy, whatever that might be. And so that might be, thrusting, or I should say penetration, like quicker movements. It could be also doing it in position. So different thrusting with your pelvis. It could be doing it in standing, doing it in sitting. Like there's so many different ways, whatever is what you want to work towards. Typically, I would find most people start lying on their back with some pillows on their kind of a little bit elevated, where they feel the most comfortable and safe, having some music, some essential oils, whatever is going to make you feel the most comfortable. That's like a nice way to start it. And then there's ways to progress it into kind of what your goal is. So that's where it kind of gets tailored. And I also get the question like, do I have to go to like size 8 on my dilator? No, you're going to go to what your goal is, whether it's your partner and you're working on the girth and the length, or whether there's a certain tool or a certain toy that you want to work towards. So that's also very individualized to the person. And some days you may progress way further and some days less. So you can spend the time kind of going in and out doing these techniques. And some people like to just put it in, hang out there for that full duration, just to allow the accommodation of the tissues. Both are great. They work different ways, but there are different techniques that you can utilize. For the pelvic wand, there's 2 ends. We didn't talk as much about it. So there's a smaller end and then the bigger end. It can be used vaginally and or rectally. The nice thing about the wand is that it curves, so it's actually easy to kind of maneuver when you're lying down to get to those deep muscles. So that's the benefit of this as opposed to here. This is more for entrance, return to sex, kind of those pieces. But if you notice or you've seen a pelvic physio and they've identified some of those like tight, kind of tense muscles that just need to be released that are a little deeper, and you don't have access to pelvic physio, or you can't see them very frequently, this is a nice tool to get into those areas, holding it for a minute or two, and then finding another spot and moving along. So that can be really effective, and some use in combination and some use one or the other. Again, depending on the purpose, but this is more for those deep pelvic muscles, whether vaginally or rectally, and you can use either or depending on kind of where you are. So that's a bit about the pelvic wand. Next slide. In regards to, I kind of think I already talked about majority of these tips. So breath work, feeling comfortable, using music, a heat pack over your abdomen can be really great in that session or afterwards. Heat just helps to relax those muscles. And then another thing is also, and Concetta had talked a little bit about, as you're progressing more towards sexual arousal, so whether working into that or just kind of working on the healing journey, if you have a partner, it's a nice way when you feel comfortable and safe to show them like, here, this is where I am, this is what I'm working on. And sometimes it's nice for them to work on it. And that really depends on you and your body and when you feel ready. And if you do, not everyone chooses to, but some actually like having a partner involved. And sometimes it's easier to kind of maneuver in some of those deeper areas. So that's also an option that you can consider. Next slide. Okay, before we finish off, we just want to quickly talk the difference between these two diagnoses. The majority of our population working with either of these tools do tend to have some form of pain with intercourse, which kind of falls within these two diagnoses. I'll speak to the first one, and then Concetta's going to speak to the second one. And I just want to say that, it doesn't matter what the label is. Honestly, it's more about kind of what you present with and how are you going to work on those symptoms. But we often get questions about the difference. So we thought it would be helpful just to kind of share a little bit about that as well. So I'll move on to the next slide and we'll talk about dyspareunia first. So dyspareunia is really just having painful vaginal penetration without anything underlying of a disease, quote unquote. So there's two types. Essentially, primary is you've kind of been like that throughout your life, where it's been a challenge for you throughout. Or secondary is, things were fine and then something happened and now you have a challenge with it. And that challenge could be a variety of different things. There are often some diagnoses that are involved with this that can be related to it. So things like endometriosis, bladder pain syndrome, just having pelvic floor tension, a lot of people with trauma, whether that's from childbirth or other traumatic experiences. These are just some examples that one can experience as per the reasons why you would have dyspareunia. It's really more like a general term. That's what you can think about it. All right, and then we'll go on to the next slide, and we'll speak to vaginismus next.
Yeah, so for vaginismus, this is considered more of a genitopelvic pain penetration disorder. So there could be any distress and difficulty with vaginal penetration, characterized for usually over 6 months and involving at least one of the following criteria. So there could be vaginal muscle tightening that prevents that penetrative piece. There could be pain, tension, or burning during penetration attempts, little or no desire for intercourse, and a low libido. Fear or phobia of penetration, and then a complete avoidance of sexual activity. The condition cannot be better attributed usually to a non-sexual mental disorder, relationship distress, or other life stressors that are impacting a person's sexual desire or any other medical condition. So this is a little bit more specific where there is more of that involuntary muscle spasm or contraction that happens with penetration. And in some cases, even finger insertion may not be possible. And it can look differently depending on the person, but generally this is the presentation. Next slide, please. So to highlight some of our key takeaways, and as Lea mentioned, I do want to reiterate that the key is to be less concerned with that specific diagnosis or label, as it's not always clear what someone may be having, especially when we see them in the clinic. There could be overlapping symptoms among different conditions, and we treat symptoms and presentation. So it's really important that we're offering those individualized, tailored approaches to all of our patients. That will be the most effective, and everyone is going to present uniquely. So we need to consider the story that's coming in. Tools like a dilator, breathwork can be helpful. There isn't a one-size-fits-all approach. So that's another key point. And then those are just generalized differences that we may be seeing between vaginismus and dyspareunia, where we have more of that spasm of muscles generally with vaginismus, and with dyspareunia, more of that painful vaginal penetration in the absence of disease. And it could also be more of that deeper penetration issue that could also be presenting as well. Yep. Next slide. Perfect. And yeah, that's pretty much all from us. We have included our Instagram handles along with Raise the Bar Physiotherapy and our contact information, along with our Jane app to book appointments if relevant and if interested. And I'll pass it over to Asia for final remarks or any questions for us.
Thank you so much, guys, for that. I learned actually quite a bit when you were walking there, especially with pelvic wands. I feel that's something that isn't discussed as much, yet can be so crucial for someone's journey. And I really like how you guys touched on how unique it is to everybody. I feel when someone buys a dilators that all they think is, okay, I just have to use dilators and that is all. But like you said, like maybe there's certain parts of like the what I call like the vulva clock, right? Where one part of the muscle is tighter than the other, or maybe it's deeper, and that's when like a pelvic one would be used. So I think you guys did a really good job explaining that. I think believe we have a few questions in the chat. I'm gonna quickly wrap up a little bit about Dilato. However, if anyone wants to take a picture of this really quick or a screenshot, I would highly recommend following them both. And I think it's so important as well to work in person. Or I don't know, do you guys offer virtual as well? Out of curiosity.
Yeah, we do offer virtual, and it sounds like there are some people tuning in internationally. So we didn't mention introduction, but we're both from Toronto, Ontario, in
Hmm.
Canada. So if there are people that are internationally, we are health coaches, so we could also do it internationally, but it
Yeah.
just would be considered covered under physiotherapy. It would just be like a health coach essentially. But
Yeah.
we do have the training as a physiotherapist. Every country is a little different in how that works, but we can practice as a physiotherapist within Ontario, both in
Yes.
person and virtual. So we do have that offering.
That's amazing. And everyone will be receiving a link to this recording and the book appointment link as well as their socials. So for those via email or want to think about it, you'll have access to these links as well after the recording. That being said, we'll quickly dive into a little bit of Dilato and then we can open the floor to a few questions, as I know a few people sent me a personal question as well over email, knowing they couldn't make it in. So before we go into the Q&A, I just want to talk a little bit about Dilato. So just like the both of our amazing speakers have mentioned, a lot of the time pain with sex is a common symptom. I myself have dealt with this personally. If you're someone that came from our TikTok community, that's something I'm very passionate about sharing. So we created a all-in-one app to further go into a lot of what Lea and Concetta have explained here, from worksheets to different chat forums. We could talk to other folk like you who have these conditions. You're able to learn it in depth. This is not to replace the amazing work of pelvic floor physios. This is actually developed by a few pelvic floor physios based in Toronto as well. It's to work as complementary. So in case you don't have immediate access to PFD quite yet, you're in waiting times, or you want something to go alongside of it, this is a great place to start. Ellie, she's also our co-founder here who was unable to make it today. She's been dealing with these conditions for over 8 years. And we team together with psychologists and sex coaches to help you walk through different methods besides dilators, as well as like guided meditations, yoga work, as well as breath work, and the psychological aspects too of having these conditions, whether you're navigating a marriage, a relationship in general. And here are just some a few examples as well from our community of people who have both worked with PFTs as well as used our app or just use the app in general. So you can take a look at this. Again, it is available in the App Store if you'd like, and I can put in the chat as well the link. And you also receive an email too about that. 80% of people who in our program have been able to actually progress in their vaginal insertion, whether it be through dilator use, finger use, being able to insert a tampon for the first time, and we do have a really great deal going on now too annually, if that's something that you're interested in. I'm just going to stop sharing the screen now so we can take a look at the Q&A section in the Zoom chat. I'm really excited because I saw a few in the chat here. We can go from Amber first off. I know, Amber, you said you're unable to unmute yourself, so I can read it out loud. And whether it's yourself, Concetta, or Leah to answer that, we can get started there. So Amber asks, I feel like my pelvic floor muscles are weak, but that's why they are more tense. I also have this in my shoulders. So should I do dilating along with maybe some strengthening exercises?
I can start with this. So generally, it's hard initially to classify where we're at, but if there is some tension, ideally we need to bring down that tension before we work on strengthening. So almost like your bicep, if your bicep is contracted and it's at this level, we can't strengthen it at this point. We need to try and bring it down, get full range of motion, relax the tissue, focus on those stretching pieces, bringing everything back to homeostasis. And then if there are underlying weaknesses in the muscle, then we can sort of progress towards that strengthening piece. So I would say in the beginning, sometimes, especially working with a pelvic floor physiotherapist, we can try to identify some root causes of that tension, and maybe that's related to some fear, past negative experiences, some pain that has been building up, and some tissue sensitivity. So that's what we would aim to do. And then we could start working with either dilators or even finger insertion just at the opening of the vaginal entrance where there may be tension, some breathing techniques, deep belly breathing, some novel movements, so different like movements that are similar to yoga and meditative practice. That's generally what would be beneficial to start with. And then if there is something related to muscle weakness and strengthening, that typically comes later on. Any other points, Leah, for that?
No, I think you said that perfectly. Just two like little interesting things. You mentioned that you have this in your shoulders. And so when we think about the pelvic floor, that is like the most protective, reactive part of our body. So there was like a study where they put electrodes on your whole body or on a bunch of people's body, and they watched a scary film. And the first part of your body to go was the pelvic floor. So it really is that protection and overprotection. But there are other parts of our body that also has a similar response. The upper trap, so your shoulders, your TMJ, your jaw, your calf muscles. So those, if you find like you're feeling tense in any of those, there's usually a relationship between all of them, and it comes back to the nervous system. And we didn't have a lot of time to go into the more the neurophysiology of the pain science today. We talked really about the nitty gritty of how to use it, but it's really about kind of down regulating the nervous system. And that's where this is coming from. And then when you mentioned that you think your pelvic floor muscles are weak, we do see in clinical practice that often muscles that are tight are also weak because, as Concetta mentioned, they're stuck here. So like how functional is a bicep if it's stuck? Like you can't reach a bottle, right? You're stuck. So once you have that full range, it's like, oh my God, there's so much to work on. So then you might need to, but it's hard to really know unless you do an internal assessment and you're able to let those muscles come to a normal resting state. So, and then everything that she said about kind of like how you would do it would be the other pieces to consider.
I love that, especially about the, oh, Amber mentioned. Thank you, Amber, for your engagement. I love this. She says, OMG, I have tension in all those areas. Ha ha ha. This makes so much sense. Thank you. Oh, I'm so glad that helped, Amber. Again, if you have any further questions for them or you want to work with them, like there'll be a follow-up email with their information. And I'm sure they're more happy to do a consultation. I believe that's what you guys would do with the health coach service, right? Okay, amazing. I have two questions that were sent by email for those that couldn't make it, that are international. The first one, both of them want to remain anonymous, but the first one is, I feel a burning sensation when I first use the dilator. It's the smallest size. Is this something I should be worried about, or should I keep going? I don't know what to do.
Yeah, so I would say with the burning pain, that's often common, especially if there is that excess tension piece. So with the burning pain or discomfort, generally it's similar treatment as what we were mentioning before, is just a matter of like starting slow and not pushing past that pain. So ideally starting with that same size dilator, also not trying to force it too far into the vaginal entrance and just starting at the beginning. And sometimes with that burning, applying more of like a gentle pressure just with either the dilator or the pad of the finger and holding that for like 30 to 60 seconds while combining that with the pelvic floor flower breathing has been shown to release some tension or discomfort. That's typically what we would do, like maybe on day one, is just starting there and seeing if we can allow the muscle to relax. So it is common sometimes with excess tension or discomfort, there could be some burning. Sometimes too, it's good to look into the lubricant piece. So if there's any sensitivity when it comes to lubricant, finding one that's right for you, using water-based for silicone dilators, but sometimes patients prefer to use something gentler like an oil-based lubricant or coconut oil, whatever it is. So that could be another reason why there might be some sensitivity, but key thing here, I would say, is start slow, apply that pressure, and not try to push past it and go too far, because then it's just going to ramp everything up again.
And I would say like one clinical pearl when doing those techniques, I often tell clients to use the mantra sore but safe. A lot of times burning is really this, our nervous system protecting us because we think this is dangerous. And it comes from a very valid place. It's just overprotecting. And so the more we can kind of have the breath work and these experiences and telling your body that this is safe, although you feel sore, that sometimes helps as you're working through it. So it is quite common, whether it's burning, stretchy, like there's so many different types of things you can experience, but it's your body telling you that, it's sensitive and you're working within a range that's tolerable. We can't emphasize enough to not push past it is to work with it. And if you're doing it and you notice like you're sore for like a few days, you've probably overdone it. Soreness can happen, but I think of it just like exercise. It should kind of go away within the next day or so. So if it's lasting you days, then you've probably overdone it. You need to kind of decrease how much you're doing, what you're doing, the depth you're going, and kind of working based off of that as well.
I like that. I never even thought of like the lube idea that it could just be an allergic reaction because I do know there's a lot of lubes out there that do have some harmful chemicals and also fragrance too. I think that isn't talked about enough to how harmful it can be for the pH for some people. Um, Another question that was sent in via email. Um, when I use dilators, it's fine in initial insertion, but I find there are certain parts, for example, like my left lower side that hurts more than others. Should I be doing something specific to that area? And that was the question. I actually have a follow-up with that because that's something quite common we get. Sometimes people say there is a certain area. So like in the vaginal opening, some people say, oh, it's the right side more on the bottom, or sometimes on the left side. Is that an indicator of something, or um, what would you suggest?
Yeah, so I think that can come down to individual differences, and it could also translate to whole body potential limitations. So, for example, if there are limitations at the hips, inner thighs, excess tension, that can sometimes translate also to the pelvic floor muscle tissues. So, generally, as physiotherapists in general, we do a whole body scan and screen and see if there's any external limitations, external tissue sensitivity or tension. And we can also work on releasing that first. And then, like you mentioned, if there are specific tender points or pain areas at the pelvic floor, similarly, we would apply that gentle pressure, try and release the area. Again, not trying to push past the discomfort or pain, but focusing a little bit more on that point. And if it's not tolerable, then doing things more externally. So if that means doing stretches or other movements at the hip, at the thigh, at the low back, that can also help with those specific points. Even just using your mental imagery and imagining those areas softening with the pressure of a dilator or with the pressure of your finger, that can also help to bring things down. So yeah, definitely very common. We see that in practice. And like Leah mentioned, usually that bottom area of the clock tends to be tender, but can really vary depending on the person.
That was really well said. I don't know if I have much to add, to be honest. I was like, oh, she's answering everything that I would have said there. Um, there was one piece, and now I've lost my thought with that one. But Yeah, I'll let that be.
Amazing. I just have one more question. I just got a direct message from someone in the chat. They mentioned, what about pain with thrusting? Initial penetration doesn't hurt as much, but during multiple thrusts, that's when it starts to hurt.
Hmm. There's a lot of pieces to that one because when it's thrusting, it's like, what's the speed at your thrusting? What's your pelvic position? What's the velocity? Like, what's the impact of it? So there's so many little parameters that you'll want to play around with. I would say that's like another progression in itself. So it sounds like your body's able to accommodate the space, but it's now when you're adding external movement. So you might need to start very gentle. It might be like just lying on your back and doing a pelvic tilt on your own and then kind of doing it more kind of, with more movement or with then the thrusting and the actual movement of the dilator itself. So it really depends. I don't know if there's a follow-up piece to it, but that makes sense that would be more challenging because that would be a harder progression. And so it's really kind of taking it and trying to break down what part in particular. And there might be multiple. So you're going to kind of do one at a time. And when that part's good, then add one more piece to it. And then when that's good, add another piece to it. And you would kind of keep progressing and adding it on. But if you're doing everything, then it's like just your body's like overwhelmed, like, whoa, what's happening here? So it's kind of taking it slow and breaking down that movement pattern. And that's where sometimes having a physio to help really break down those specifics can help guide you because that's a very like general thing of thrusting that could mean so many different things.
Thank you so much. I hope that helped you out to that person in the chat that mentioned that. And again, if you have any further questions, I'm sure they're more than happy to answer any of them or do a consultation with you as well. I believe that is all the questions for now. Was there anything else you guys would like to add to the chat before we close it off for this evening?
I don't think there's much from my end. I think like we've said it many times, but it's really about kind of taking it slow, feeling in a safe place, working at your own pace,
Mhm.
and things will get better. Like it really does. It's just kind of continuing with this practice. And there's a lot of guided breath and guided imagery that goes along with it because it's not just the physical piece of these tools.
Yeah.
It's what it means and the science behind it. And I can't emphasize that's actually the foundation of how you see that change.
Mm.
Oh, couldn't agree more. That was very well said.
Well, thank you so much, Leah Concetta. It was a good, well, one refresher of how to use dilators again, but also two, I love how you pressed on it's more than just increasing in size. It's about your actual experience when using it, how you're using it, how does your nervous system feel, and then physically, are you listening to your body while you're doing it? Because it may be telling you signs. Like for example, a pelvic wand may be better of use based on your unique case. I really can't wait for everyone else to also watch back this video and to share it. And it's amazing you guys also have that health coach option. So leave this as a nice, gentle reminder for everybody as well listening back to this that it seems like they're open to for people to work with them too. And again, having a great evening, everybody. Appreciate you guys creating this safe space for everyone to ask their questions and welcome in any follow-ups after this. But we'll leave it off here. Thank you again, both of you, for your time and sharing your knowledge and creating this compassionate haven for everybody here who needs this.
And thank
Thank
you so much for having us.
Of
We
course.
really enjoyed it. And if anyone has any questions, we're happy to answer it offline as well.
Of course. Thank you, everyone in the chat, for your love and gratitude. Have a good one, guys. Cheers.
Thank you.
Bye.
Bye.